A neck strain is nothing more than a muscle injury to the different muscles around the neck. You know, the whiplash injury is a kind of a stretch injury. Any you got to think about a muscle. A muscle does two things. It gets shorter under force, or it gets longer under force. So if I lift a weight up using my bicep is doing what's called a concentric contraction. If I let that weight down, it's not the tricep pushing it down, it's the bicep letting it down. So that's called eccentric contraction. It seems kind of contradictory. I'm using the word contraction, but the muscle's getting longer. And the whiplash injuries occur when there's when you get a force that's trying to, the muscle is trying to decelerate a force. So if you get hit from behind, your head starts going back because your body's going this way. So these muscles are trying to decelerate that. Then all of a sudden you get the force, you stopped and you start going this way, and then the muscles in the back of the neck try to decelerate that injury. Happens a lot in car accidents, but it can definitely happen. It can happen in soccer, it can happen in football. And those injuries are what's very typical of those injuries, you have something called delayed onset of muscle soreness. They're a little sore when it happens. The next day they can barely move their neck. So if you see somebody with a whiplash type injury, you put them on an anti-inflammatory really quick to decrease that inflammation. And then it's just treatment of the symptoms.